Gauteng has 660 active vaccination sites. Premier David Makhura says the priority for the province is to increase the vaccination drive. He's visiting vaccination sites in Gauteng today. Senior eNCA reporter Aviwe Mtila is following that story and joins us now from a drive-in vaccination site in Gauteng. I believe you are, Aviwe. That's one of the sites that I suppose Premier David Makhura will be hoping will help the province stem the third wave.
Certainly one of the 660 vaccination sites in Gauteng alone, both from the public and private sector. In fact, Premier suggesting that we're seeing the end of the third wave of COVID-19. In fact, this is just one of those sites assisting and with a broad target there of 100,000 vaccinations by August, daily vaccinations, in fact, in Gauteng province alone by the month of August. But the Premier did caution, though, that the recent unrest and upheavals that we've seen in and around Gauteng, those will come out, the results of those, and the true reflection of the COVID-19 pandemic, and of course those thousands that went on to loot those malls and shopping centers. The true reflection of those numbers will only be seen in a week, in the coming week. But for now, the suggestions from Premier David Makhura is that the numbers are dwindling, both in the hospitalizations and the number of infections in Gauteng. Just listen in on the Premier there.
By all accounts and all indications, Gauteng province and one can also say the country has peaked quite substantially. The infection numbers are coming down, but also the hospital admissions, as well as those who are succumbing to COVID-19, the positivity rate. So the major indicators to tell us whether we have really peaked are on the positive side. On the positive side means that we welcome these indications. But as we have that, as we have the infection, the number of people who are testing positive coming down, and the number of those who are getting hospitalized coming down, we are concerned about those who may, especially in the course of the unrest, those who may have interacted in significant numbers, and that we will see the following week whether that is going to have an impact in the province.
And as the Premier was speaking, Aviwe, one of the other issues that the province of Gauteng, well, at least parts of the province will be dealing with, is a matter of a water cut that I believe will last some 37 hours. What did the Premier say about that situation?
Didn't want to be drawn in too much on that issue, in fact saying that the relevant stakeholders will work towards those issues. But he did acknowledge that it's not only a water crisis, it's also an electricity crisis in the middle of winter, the cold winter, of course, electricity crisis, and in the middle of the pandemic it is the water challenges. You rightly mentioned that for the next 37 hours in and around Gauteng, over 10 communities will go without water starting from tomorrow morning. And in fact, those 10 communities will have, of course, those water shortages, but they will be provided with water tankers, which is another careless issue given the COVID-19 pandemic, expecting thousands. That's, of course, over 5,000 households, so that means thousands will be descending on those water tankers. You can rest assured that those social distancing measures won't be upheld. A question that I posed quite pointedly to the Gauteng Premier, David Makhura, and this is what he had to say.
We constantly have the problem of the water problem in our province. It has been happening in the midst of the the COVID pandemic. We've had problems that Rand Water would report in our municipalities. But as soon as we have that problem, we consult with the relevant authorities. The provincial government would consult either with Rand Water or the relevant municipality to ensure that firstly, there's an immediate intervention about water supply, and then we get to sort out what the problem is. If it's a problem of Rand Water, we work with Rand Water to make sure that that is addressed.
Aviwe, one quick one then. You are at a drive-in vaccination site. And of course, that's to deal with the long queues that we have seen forming since, the provision was made for people to be able to walk in if they've already registered. So to try and get as many vaccination sites as possible going, we now have these drive-in vaccination sites. I know there's one at Grace Bible Church in Pimville, Soweto. What does that one look like? Just quickly show us what it looks like. What's the flow like at a drive-in vaccination site?
Yes, the people just this very moment are coming through, and I must say that even outside this Houghton drive-through site, there's not much traffic, which suggests that the cars that are inside are moving in quite smoothly. You can see that there are different parking bays, about 5 for each of the cars coming in, and if there are more than 3 people in the car, one is asked to come and sit outside where he gets that jab, and the rest even get the jabs inside the car. We understand that around 300 people get vaccinated in the site, but in an earlier site that we were on at the Witkoppen clinic there, we understand around 600 people get vaccinated there, but the target is to reach 1,000 vaccinations at that particular site. Understand in Gauteng as a whole, 660 vaccination sites, with the Premier targeting for the month of August to reach at least 100,000 vaccinations per day in Gauteng alone.
Wow. Let's pause there. Let's keep those visuals there for a moment there. Just that is what we wanted to show our viewers, that actually now the pathways to vaccination are actually opening up. As you see there, that person inside the car didn't have to leave the passenger seat and has already been vaccinated. And I suppose even the driver as well will be vaccinated at the same time if they are not vaccinated already. So that's what it's looking like. Thank you for that. That's eNCA's Aviwe Mtila showing us just what a drive-through vaccination site looks like. It's a good initiative, given the inconveniences of life. We have so much to get through, and some people have many errands to run on any given day.